We started out really as an organization called Justice for Health. And I think a number of us got together feeling that there was a need for all of the participants in healthcare delivery to be accountable, including the patient, the provider, the personal provider, the physician, nurse practitioner, or the hospital, and all institutions that lend themselves toward delivery of care. We got so many calls, though, about legal issues. We had that name that we thought we might rethink that, because we were not really organized primarily for legal redress. We were really organized to advance the concept of accountability for healthcare. And along came Denise Bollheimer, actually, who was involved in some other organizations, and we started talking about the need for, and we had already discussed this initially, about the need for choosing a particular focus. And we chose obesity and diabetes as our focus areas. And when Denise joined us, just for interest's sake, we became Healthy Memphis Common Table.
So the common table was that essential ingredient that we hadn't come up with a name for until early in 2003, when Bob Waller, Dr. Bob Waller, said, you know, what we really need in Memphis is some sort of a common table. He coined that phrase, and we all jumped on it and said, gosh, that's exactly right. It's what we've been trying to create, but we hadn't had a name for. And why it's important? It's important because Memphis is full of different voices about what needs to happen, what we need to do, but there's some aspects of how we build a healthy community that unless people work together on, unless they come together on and agree on the best course, nothing's really going to happen. So this whole effort from the beginning has been about creating a common table, a space where people can work together outside of that competitive healthcare environment for what's really good for the community.
The Healthy Memphis Common Table, it grew up from an idea and became a very accomplished organization that is doing all sorts of wonderful things. You know, we've got vending machine legislation that's occurred that helps kids have choices or businesses to have healthy choices. We have coordinated school health network now. We have a Healthy Choices Week in schools. We've got the food and beverage industry offering healthier choices now. We've got all sorts of things that have occurred because the Healthy Memphis Common Table may have been a catalyst or a group that was keeping the discussion going and getting people that might not have been on board before on board, because it's important for everybody.
I'd like to see Healthy Memphis Common Table continue the same track and continue to work on population health and health equity. That's part of our mission now, to really develop that concept. Because if you look at healthcare by itself, you know, the system, that only accounts for 10% of the improvement in population health. The other 90% is outside the medical system. And so we definitely need this concept of population health and have people understand it. And we need to make changes on multiple levels in our society to get rid of the health inequities that we see.
I believe in a healthy Memphis, and you should too.
I believe in a healthy Memphis, and you should too.
I believe in a healthy Memphis, and you should too.
I believe in a healthy Memphis, and you should too.